account would be depleted in no time. I mean, so that's not a solution to, finance very expensive healthcare. Maybe, for a cold or, just little minor illnesses, but that's definitely not, sustainable.
And there was something else I had noticed on your healthcare when you were investigating it and getting it put together, was a study of the racial divide in the healthcare systems. Would you like to talk a little bit about that?
Well, there is a racial divide in the healthcare system in a couple of respects. The first is that many people of color, African Americans, Latinos, Asians, have very different healthcare circumstances. They need more healthcare. And because they don't have it, they have less, they are subject to a higher frequency of illnesses. And the problem that creates is that the people with the least insurance or no insurance are the ones that need more doctors, clinics, hospitals, and examinations than anybody. The first thing that we're learning is that this country needs to look at what other industrial countries around the world are doing, who all have some form of universal health care. And I want to make it clear that the plan that we have is not based on anybody else's model. We've looked at these other plans, but this is uniquely an American system that we're operating under. Minorities have greater health care needs because they have less use of hospitals, clinics, doctors, and health care providers. And so, ironically, they who need the most get the least because it's based on a system, it's called an industrial system. I've got a wonderful remark from the former head of the New England Journal of Medicine, Dr. Arnold Relman, who pointed out that what we've got here now is a medical system. Well, let me just read a sentence. Commercialization of healthcare in the United States created what I term the new medical industrial complex. In a 1980 article in the New England Journal of Medicine, I was referring to a medical care system that had begun to attract investors and in which business interests had started to reshape the behavior of doctors and healthcare facilities. And so what he's talking about is that the corporatization of healthcare means that it's being run from a business point of view. We, on the other hand...
Like I often hear the term prison industrial complex, military industrial complex.
The military industrial complex.
Where it's all become down to the corporations. Now, Radia, have you studied the other industrialized nations, their systems, and what's your take on that?
Well, actually, for considering the wealth of the United States and the amount of money that is, put into the system, it's really shocking to have these kinds of health outcomes for the people. For example, while in the United States, an average of $7,000 per year per capita is spent on health, and France gets much better results on any health indicator by spending less of that, half of what the U.S. is spending, it's pretty much the same amount of spending in England, for example, but by the way, which is a socialized medicine. But I really want to take this opportunity to, you know, make sure that everyone understands what socialized medicine is.
Does that mean that we're stepping one step closer to socialism?
No, not with HR 676. It's not socialized medicine. I think this is really, you know, people like to use that term to sort of, you know, bring some fear, you know, and it works very well, you know, in America, because it sort of, you know, rings back to communist era, you know, it's like Soviet type of, you know, bureaucracy, government. But it's not. In England, it's socialized medicine because the doctors are paid by the government and they're hired by the government. But here, with HR 676, it's the government will be responsible for financing insurance, but doctors will be, you know, responsible for their private practice. So people will be able to, you know, choose their doctors. There's no interference with, you know, patient-doctor relationship. So this is a lot. So the models that are out there, as Congressman Conyers said in the beginning, are different from what he's proposing. I think this is a mix of, you know, models that exist out there. But the bottom line is this system in its current shape is not doing the best. I mean, and I know
the American system right now,
the American
based
system
on capitalism.
as it is, because they treat healthcare as a market commodity, not as a human right. Even the Cubans, you know, for the Cubans, it's a pillar of their system. Health and education are just pillars of their entire system. So as long as we have, you know, private corporations running the show, this is just not compatible with the ethics of medicine and, you know, the delivery of healthcare. And that's how you end up with really with disparities in healthcare,
such as the minority issue
it's just
that we were just
as a
discussing.
minority issue. And you know, if you just look
and
at
do they see that problem with in other countries as far as with the healthcare? Has it been studied?
Yes. Well, you know, there's always the issue of income, you know, and social class. So at least with, you know, universal access to care, single-payer system, you try and reduce those disparities in terms of, you know, access to care. At least you work more on your primary care system. You don't wait until people get sick and it's unmanageable. This really drives the cost. And for a lot of people, for low-income people, and, you know, and a lot of minority are just low-income people. So it's not that they're, you know, more stupid than anyone else. It's not that they're more, you know, more lazy. It's, you know, it's sort of an equation. You know, they have to sort of, you know, so do I save this money for food, you know, to pay my bills, or do I spend this money, you know, on my health? And they'll just wait until really it's a bit late in the process and go to the ER.
And I'd mentioned emergency, 45 million uninsured Americans right now, and healthcare by emergency.
Right. That's George Bush.
You know, it's,
that's what George Bush says. Well, you know, there's always the ER, but that's not how we should be using
doesn't that,
ER.
I mean, doesn't that cost then skyrocket if the uninsured then go to the emergency for what could have been maybe a simple cure, preventative, rather than the emergency? Does your bill address this and take care of any of those problems?
When you are first come into this world in the United States, you get a health care card, and that card identifies you beyond any question, and that entitles you to whatever health care that you need. And if you don't have any money, the small 3 or 4% that one would pay based on your income does not apply if you don't have money. So there's no money that exchanges hands as it does now. You
mean you can go to the doctors, and you don't have to have the $50, the $100, the copay, the prescription copays, even if you do have insurance, you just go in and see a doctor.
Well,
and as in America, it sounds like...
Well, it's Michael Moore in his documentary couldn't believe some of the experiences that he had, because there was no place for anybody to pay for the services because everybody got them, period. And under
you're
our
talking
plan,
about Sicko.
Yes, I'm talking about that movie that won, a documentary that won all these awards. And I was trying to reach out to Michael Moore because everybody wanted to get a copy of his film. He came up on the Hill,
Right.
came to the Judiciary Committee. I was very honored to receive him, and he had a special showing for the Congress, the members, and their staff. And it was a wonderful premiere.